Hi everyone. Today's lecture is about diagnosis and treatment planning. We know that diagnosis is a very important aspect in every branch of medicine. Without proper diagnosis, a proper treatment cannot be done. We need to identify the disease first, then only we can plan a treatment which will result in re-establishment of the health of the patient. So the first step in a correct treatment or a perfect treatment planning is proper diagnosis. So let's see what is the diagnosis and treatment planning in endodontics. Like William Osler, the father of modern medicine, said, listen to the patient, he is telling you the diagnosis. Diagnosis is basically uh, is done to distinguish irregularities and other issues of concern based upon the patient's examination and interview. So it is actually a conversation or an interview with the patient and also a series of examination which the medical practitioner does on the patient. The word diagnosis is derived from the Greek word dia, which means thoroughly, and gignoska means to know. So it is basically a search for identifying the irregularity or anomaly within the patient. So in order to identify irregularity, the clinician should clearly understand what is normal and what is abnormal because the eyes do not see what the mind doesn't know. So a thorough knowledge of normal and pathology should be is the power to a proper diagnosis. Coming into the definition of diagnosis, it is the art and science of detecting deviation from health and cause and nature thereof, according to Glossary of Endodontic Terms, 7th edition by American Association of Endodontists in 2003. So it is basically detecting the deviation from the health and cause and nature thereof. Every diagnosis starts with a case history. As I have told earlier, the case history is a very important aspect in diagnosis because, as the father of modern medicine said, William Osler said, listen to the patient, he's telling you the diagnosis. So, in order to listen to the patient, we need to take a history from the patient. So basically, the case history, it commences by asking the patient for the following data. That is patient's name, age, address, occupation, etc. That is his or her personal details. Why the name is important? The name can be important because by calling the name of the patient, we can create a rapport with the patient. In order, instead of calling patient, some patients prefer to get called by their name. So calling by name is a very important. It is a very important step in making a relationship with the patient, so that there is a warm relationship between the doctor and the patient. And age is very important because there are age-related diseases which can be exclusively seen in certain age groups, and there are certain childhood diseases, and there are certain sex-related diseases which can be seen exclusively in one gender and not in other gender. So noting the age, sex, and all are very important. And we need to know the address of the patient in order for proper communication, and also to know whether the patient is coming from any endemic areas which is affected by any diseases, like any, for example, fluorosis. Certain areas in our country is endemic for fluorosis. So if we know the address of the patient, we can guess that any molting on the tooth can be as a result of fluorosis. That's only an example. There are several applications for noting the address. And of course, occupation. There are several diseases that is related with occupation because, for example, the classic example is that of an untreated central incisors, which is most commonly seen in tailors and also for electricians who cut the wire or hold the needle with their incisors. So there are certain occupation related or job related dental anomalies which can be commonly seen. And all this above data helps in establishing a communication, maintaining a record, and understanding the economic status of the patient. Besides these clues, this name, age, sex, address, occupation, etc., will help to understand background study or background of the patient, and also his economic status, and also his attitude towards dental treatment. Every diagnosis starts with asking the patient the chief complaint. Why or what is the reason for his visit to the clinic on this particular day? So basically, the chief complaint is recorded in patient own words. There are no medical terms used. The complaint should be noted in his own words in layman terms. So maybe the complaint like the patient might complain of a cavity, or might be complaining about a pain or something like that. It might be complaining about sensitivity. That are the common complaints which we hear in the dental OP. So it should be noted in patient's own words. Why it is important? Because finally, after the treatment, the chief complaint of the patient should be addressed. So in order to avoid any bias from the side of the doctor, the patient's chief complaint should be noted on his own words. And after the completion of the treatment, that particular complaint should be rectified. So in order to identify that the chief complaint is written in patient's own words. Mention only the chief problem of the patient day in the order of severity. There is an order for writing chief complaint. If the most recent complaint is written first, and the chief complaint, if the patient is having two complaints, that is, the patient is having a decay and a sensitivity, or decay or pain, the pain will be more recent. So we should write pain first and then decay second, or it should be on a chronological order in which it is presented. So, and also on the order of severity, which is more important for the patient. And we should follow the chronological order. And it is very useful for future references and also for attaining into a correct diagnosis. So these are the common chief complaint that we encounter in dental scenario. That is, the first and foremost, the most important chief complaint is pain. Of course, it is a pain. Patient can present with several numerous type of pain, which can be there are several categories for the pain. It can be dull aching pain, it can be throbbing pain, it can be an acute pain, it can be chronic pain, it can be so there are several categories for pain. Another important chief complaint is the swelling, which may be associated with pain or without pain. And other complaints which commonly encounter in a dental setting is abscesses, fistula, broken teeth, teeth discoloration, and many more. If the patient complains of pain, we should ask certain questions. One thing which we need to keep in mind is that generally, while taking history, we should not ask for any leading questions. We should listen to the patient, what the patient says, but we should not miss certain points while dealing with certain complaints. In case of pain, we should specifically ask, when did the pain begin? So patient might tell you the history of pain which originated years ago or months back, and then it regressed, and it maybe it aggravated, and it regressed, it accentuated, and the course of pain. How did it happen? How did it origin? How it is going, etc. And of course, the next question will be, where is the pain located? This is important because the pain, if the patient can locate the pain particular to a tooth, then most probably the pain will be from periodontium, that is apical periodontium, or maybe periodontium, because and pulpal pain is usually ill-defined because the cortical representation of pulpal nerves is less, whereas periodontal representation in the cortical, in the cerebral cortex is more, so that we can pinpoint the tooth if the infection has reached into the periodontium. But if in the case of pulpal pain, the pain can be felt in an entire arch or entire side, or even can radiate to upper and lower sides. So the location, pain location, is a very important feature which should be asked when the patient complains about pain. Is the pain always in the same place? Is the pain shifting? Is the pain is changing its position? We should ask. What is the character of the pain? As I've explained earlier, the pain can be short, pain can be sharp, pain can be long lasting, pain can be dull, it can be throbbing, it can be continuous, it can be occasional, etc. So we should specifically ask. This is important because a short, sharp, and a throbbing kind or continuous kind of pain signifies an acute inflammation, whereas a long-lasting, dull, occasional pain is a characteristic of chronic inflammation or even an abscess or a chronic abscess, etc., like that. So the character of the pain is very important to identify the disease. Does the pain prevent sleeping or working? This is also another important question to ask, because the patient when he goes into a supine position, the blood vessels at the apical, you know that apical foramina is a very small foramina. Vascular congestion can occur when the patient goes into a supine position if the apical tissue is inflamed. So in order to differentiate this, we can ask if the patient is having any problems with sleeping, or while the pain aggravates during sleeping. Is the pain worse during morning? The opposite should be asked. Is the pain worse when you lie down? The same reason. Did or does anything initiate the pain? That is, anything which aggravates the pain, like trauma, biting, thermal, etc. Once initiated, how long does the pain last? This is also important. This differentiates the pulp from reversible states and irreversible state. If the pain is lingering, that is, it is staying for a longer period of time, we know that the pulp is going into a irreversible damage. Is the pain continuous, spontaneous, or intermittent? These all differentiate different types of pulpal pathology. Does anything make the pain worse? Hot, cold, biting. This also signifies, for example, cold. If the tooth is more sensitive to cold, it is more likely to be an irreversible damage. If the tooth is more sensitive towards hot, the pulp is more likely to be necrosed. If it is responsive towards biting, there is a chance for vertical fracture. So it goes on like that. Does anything make the pain better? In case of certain irreversible pulpitis, cold compression makes the patient feel better. And even in some cases, the analgesics makes the pain better. So all these things should be noted, which helps to reach the correct diagnosis. Similarly, just like the pain, if the patient is having any swelling, we should ask certain questions regarding the swelling also. So we should ask, like, when did the swelling begin? How quickly has the swelling increased in size? This is important because if a swelling is happening overnight, that is, it has happened within a few hours, it is likely to be an acute response, whereas a small or a slow forming swelling is maybe something which is benign or even some chronic lesion. So it is important, that is, how quickly has the swelling increased in size. Where is the swelling located? We should specifically ask where is the swelling located. Based upon the location, the area affected can be localized. What is the nature of the swelling? It is hard, tender, etc. Is there any drainage from the swelling? Is the swelling associated with loose or tender tooth? And such kind of questions should be asked or examined if a patient reports with pain and swelling. Similarly, with other complaints also. After chief complaint, we will record the patient's medical history. Why the medical history is important? We know that our oral cavity is not an isolated area. It is an integral part of human body, and the patient will be having numerous medical history or medical diseases which can occur, which can even alter or might alter our dental treatment also. So our dental treatment should be harmonious with the general health by definition. So there is an impact in patient's health on the dental operating team. So we should know the medical history of the patient. If the patient is having any serious medical history which require alteration in our dental procedures, or need for any modification, etc. And if there is any serious medical issues which requires physician's consent, the physician's consent and contact should be obtained. The dental procedure should only be performed under the consent of a registered medical practitioner. And there is a simple checklist for medical history which is developed by Scully and Cousin. which goes like ABCD up to L. And the first in this category is anemia. While the patient is having anemia, the patient might have problems while getting up or uh, getting up from a supine position, because the patient is having the volume of blood is more, hemoglobin is less, so the patient might have can have postural hypertension, or patient can go into syncope if the patient is anemic. And in case of bleeding disorders, which is very common nowadays, the patient can undergo prolonged bleeding. Or if the patient is having any gastric problems, also bleeding disorders can occur. And cardiorespiratory disorders, very important category, especially infective endocarditis, which require antibiotic prophylaxis in most of the cases. And also recent myocardial infarction or any ischemic heart diseases within 6 months period needs usually, or elective treatment is deferred from a period of 6 months. And also in case of any prosthetic valves or cardiac surgeries or corrective surgeries, etc. All these things should be taken into consideration. And very important other feature, other thing in the checklist is the drug treatment and allergies. We are prescribing antibiotics, painkillers, and other drugs. And of course, we use multitude of materials like intracalar medicaments, irrigants, etc. So the patient should be asked thoroughly for any allergies, noted non-allergies, and also patient should, the complete history of drug treatment should be obtained in order to prevent any cross reactions with the drugs which is the patient is already taking. And also endocrine diseases, fits and faints, gastrointestinal disorders, hospital admissions and attendance, infections, jaundice or liver disease, kidney disease, likelihood of pregnancy or pregnancy itself. In case of pregnancy, the second trimester is considered as safest period, but the X-ray taking radiograph should be done with caution while the patient is pregnant. And also during pregnancy, the chair position should be left lateral position so that it does not compress the inferior vena cava in a supine position. So the patient should maintain a position of left lateral position in case of pregnancy. So far, the only systemic contraindication to endodontic therapy is uncontrolled diabetes and very recent myocardial infarct. In all other conditions, we can do a root canal, we can proceed with the root canal treatment with proper consent and control in a controlled environment. And there are certain dental conditions which can mimic medical conditions. For example, the maxillary sinusitis can mimic a dental pain, especially in upper premolars and first molar, because the maxillary sinus, the roots of these teeth are in close proximity with the maxillary sinus. So if the patient is developing a maxillary sinusitis, the patient might complain of toothache, but actually the pain might be originating from the sinus inflammation. And there is a chance for a referred pain. We know that certain cardiac pain can be referred into mandible, can be presented as jaw pain or even in pain in the lower incisors, which is known as referred pain. So this kind of pain we should consider all the differential diagnosis. We should examine the tooth thoroughly and also take the proper history of the patient if it is, and find out if it is a referred pain. And also TMJ problems can also mimic dental problems. And there are other wide range of problems like neuralgias, etc., which can also mimic dental pain. After history taking, we will start the examination. So far, we were asking for we were interviewing the patient, taking history from the patient. What is his complaints? What is the nature of his disease? What are all other diseases does he have, etc. From now on, we will start the examination. We will examine the patient. We will look for the abnormalities. So the first and foremost, we'll examine the extraoral conditions. That is, clinician should look and analyze the patient as soon as he enters the room. It is said that the diagnosis starts when the patient enters into the clinic. That is, the patient's gait, the way he walks into the clinic. From there, the diagnosis starts. And We should look for general appearance, skin tone, facial asymmetry, swelling, discoloration, redness, extraoral scars, sinus tracts, and lymphadenopathy. So a general assessment should be done in order to assess the patient's skin tone, facial symmetry, facial swellings, discoloration, redness, extraoral scars, sinus tracts, and lymphadenopathy. In extraoral examination, the patient should be looked for any facial asymmetry and swelling. We know that all our faces has a certain amount of asymmetry, but we should look for any gross asymmetry or swelling. As in case of this diagram, the nasolabial fold and the fold below the eyes is lost. And there is a clear swelling in this side of the patient. So such kind of gross swellings or asymmetries should be noted. And loss of definition of nasolabial fold on one side of the nose may be the earliest sign of canine space infection. This can result from infected maxillary canine or long-rooted incisor. So here there is a canine space infection, whose earliest symptom is a obliteration of nasolabial fold. In case of buccal space infection, infection for the buccal root of maxillary premolar, molar, mandibular premolar, and molar tooth can cause and can present a swelling like this, as you can see in this picture. The buccinator muscle attachment runs from the ramus of the mandible to the corner of the mouth. So the roots which project up and down from this buccinator muscle, the space infection can occur from those root tips. Then we have submental space infection, which is commonly associated with mandibular incisors. Which is very common and a situation which can even progress into fatal or medical emergency, which is known as Ludwig's angina, which require immediate medical attention. So it is also a very serious situation which we have to take into consideration. If the submandibular and sublingual infection takes place simultaneously, it is known as Ludwig's angina. Submandibular space infection in the lower molars or pericoronitis, etc., can cause submandibular space infection. So after that, we will palpate the salivary glands. Usually, a bimanual palpation is used for palpating the submandibular glands. That is, we place one finger inside the oral cavity and one finger outside the oral cavity, and will palpate by using both the hands. This is known as bimanual palpation. There is also bidigital palpation, by which we use two fingers of one hand, but here we use bimanual palpation. And palpation of lymph nodes, we have a certain group of lymph nodes like posterior auricular, anterior auricular, occipital, jugulogastric, superficial cervical, post-cervical, supraclavicular, etc. So the cervical and submandibular lymph nodes is important part of the diagnostic procedure. If there is a swelling or feels firm and tender with elevated temperature, then this is greater chance of systemic involvement. So and we know that the infection, if there is any infection in the face or in the oral cavity, it can drain into the submandibular sublingual lymph nodes, and from there it can drain into the cervical group of lymph nodes. So if you suspect any infection, we should palpate these glands so that if there is any tenderness or swelling, we should suspect an infection in the area. So this is how you palpate the different important lymph nodes in the orofacial region, that is pre-auricular, that is right in front of the tooth. Here also we use a bimanual palpation. We use both the hands. And behind the ear, we have post-auricular on the mastoid process area. And then we have, behind the ear, and we have occipital lymph nodes close to the occiput of the skull. And we have submental below the chin, and submandibular, and also anterior cervical chain of lymph nodes. After lymph nodes, another important structure is the temporomandibular joint. It is also palpated by using a bimanual method. Index finger are placed in preauricular region, and the patient is asked to open the mouth and perform lateral excursion. Notice any restricted movement, deviation in movement, jerky movement, clicking, and locking. We know that the mandible can show deviation and deflection. So we'll stand in rear position, and we'll check for any deviation or deflection of the jaw while the patient is opening his mouth and closing. And also We can use this bimanual palpation in order to detect any clicking or jerky movements in the joint. After extraoral examination, that is examination of general indicators of pathology and also specific to dental pathologies, we'll come into our area of interest, that is intraoral examination, which starts from the oral mucosa. Actually, it is said that the intraoral examination starts from the vermilion border of the lip, that is the junction of the skin and oral mucosa. So oral tissue should be dried prior to examination, and it begins from the lips and progresses to oral mucosa, cheeks, tongue, periodontium, gingiva, palate, and muscles. We should look for any signs of discoloration, inflammation, ulceration, and sinus tract formation in these structures. And one thing which can be very useful in endodontic diagnosis is a sinus tract tracing. Suppose we have multiple tooth in which a correct pathology cannot be identified clinically, and still it is associated with the sinus. We need to know which tooth is associated with the sinus. We can use a sinus tracing. So a sinus tracing can be done by using a 25 or 30 size gutta percha, which is inserted into the sinus opening, and it is progressed up to where the resistance is felt. It might cause little discomfort to the patient, but when you take a radiograph, we can clearly see where the GP has spent. That is where the sinus is originating, or which is the culprit in this case. As you can see in this diagram, they have placed a GP into the sinus and taken a radiograph, and you can see that the GP cone has gone to tip of this tooth. So the culprit is this teeth. And we should, after examining all the soft tissue, after completing soft tissue examination, we will move on to the hard tissue examination. Examine the teeth with mirror and explorer and look for discoloration, fracture, abrasion, attrition, erosion, caries, defective restoration, or other abnormalities. A discolored crown can be an indication of pulpal pathosis. You can, first thing is to observe the tooth for any discoloration, for any fracture, abrasion, attrition, erosion, etc. And if the tooth is not having any caries, but it is discolored, it can be indicative that the pulp has undergone necrosis. So first we will examine the tooth. Then we can even use a sharp instrument which should be run through the pit and fissures. We should use proper lighting and can use a mouth mirror to examine. It is advisable not to probe too much into the enamel so that the remineralizable areas may not get damaged. After examination, we will go into other test, which is known as the percussion test. Percussion test is usually done by using a firm digital pressure or by using the handle of an instrument like a mouth mirror. We should first use a finger, use a digital pressure, then we'll move on to any handle of an instrument, that is any blunt instrument, like the backside of a mouth mirror. The tooth is percussed in a vertical direction. Several tooth is percussed repeatedly, and the response should be compared. Place the index finger on the incisal edge of oclusal third of the tooth and push inward with gentle pressure. So usually the percussion test is done using so it is done to detect several abnormalities like ankylosis, or to detect an apical periodontitis pathology, etc. So percussion test is simple but very useful. It is useful in case of inflammatory condition of apical periodontium. First clinical indication of apical periodontitis, symptomatic apical periodontitis. In case of symptomatic apical periodontitis, it is more sensitive, and in case of pulpal disease, not revealed unless apical periodontium is involved. And after percussion comes the palpation. We will palpate the vestibular region, apical region of the root tips, tenderness, swelling, fluctuation, hardness, etc. Tip of index finger can be used. Place the index finger on the periapical area of the tooth with firm, gentle pressure. If the periapical area is normal, there is no response, and if it is inflamed, there is pain in the area. After that, we will check for the mobility of the tooth. We should move the tooth in a buccolingual direction. Index finger or the lingual surface of lateral force is applied with instrument handle from the buccal surface, or by using two fingers. There is an index for classifying the mobility of the tooth. Class 1, first distinguishable sign of greater than normal movement. Class 2, movement of the crown as much as 1 millimeter in any direction. Class 3, movement of the crown more than 1 millimeter in any direction, and or vertical depression, rotation of the crown in its socket. Finally, we have periodontal probing, which is used in endodontic periodontal lesions mimic each other concurrently, so that it is used to detect these conditions. And record probing depth, periodontal health and prognosis can be determined by using this. And entire circumference of tooth should be probed. Periodontal probing can help in identifying periodontal disease, vertical groove defects, cracked teeth, vertical root fractures, external root resorption, etc. So that's by that we will conclude this lecture, and we will continue this lecture with the pulp vitality test in the next session. Thank you, everyone.